So the last part of tissue healing we're going to talk about is burns. So burns are sort of a special type of injury with special types of healing. Burns can be either thermal, caused by flames or hot fluids, or chemical, non-thermal, including chemical, radiation, electricity, light, like sunburns, and friction, like a rope burn. So all those different things can cause burns. So burns are classified by the type of tissue damage. And first degree, second degree, and third and fourth degree is sort of the old way of classifying burns. Now they're referred to as superficial, partial thickness, deep partial thickness, and full thickness. So superficial partial thickness is used to be the first degree burns. It involves the epidermis and part of the dermis, and there's little, if any, blister formation. So this is your classic sunburn. Deep partial thickness or second degree burns includes the epidermis and part of the dermis. There is blister formation and a lot of times a serous exudate. Full thickness third and fourth degree burns is destruction of all skin layers and often the underlying tissues. So third and fourth degree burns are serious no matter what. And the more area of the body they cover, the more serious they are. So the effects of burn injury can be both local and systemic. It can cause dehydration and edema. It can cause shock, respiratory problems, pain, infection, and increased metabolic needs for the healing period. So lots of effects, even though burns are on the skin, they can affect your entire system. So the rule of nines is a method for calculating the percentage of body surface area that is burned. So basically, all the areas of your body are divided into factors of 9. So the head is 9%, 4.5% on each side. The two arms are 18%. 9% for the whole arm, 4.5% on each side. The trunk is 36%, so 9% on the upper torso, 9% on the lower torso, 18% on the front, the anterior side, 18% for the entire posterior torso. And the two legs are 36% together. You can see the divisions of those. And the perineum is the remaining 1%. So this is a method of, so when they say they had third degree burns on certain percentage of the body, this is how they calculate it. There is another method for calculating burns, and it's, I have it in the module for pediatric burns, because children have greater surface area to their entire area. And so pediatric burns are a specialty area. And so there's another method. You can use the rule of nines, or you can use another method to calculate. So pediatric burn treatment and burn treatment in general is a specialized area of physical therapy. And so if it's something that you're interested in, it's not considered entry level, of course. That's something that you would get continuing education in, but it can be a really interesting area because people need a lot of surgery and physical and other types of therapy to recover from burns. So when burns are healing, you get hypermetabolism during the healing period, meaning you're going to need more nutrients and more things because the body is really trying to recover that. An immediate covering of a clean wound is needed to prevent infection. Healing of deeper burn wounds can be a prolonged process, and scar tissue is always going to develop even with skin grafting, with anything above a second degree burn. Physical and occupational therapy are often necessary for maintaining mobility, and surgery may be necessary to release restrictive scar tissue. So if you're interested in burns, there is a case study on a pediatric burn in the module. You can read it. I just basically want you to know the learning objectives for the burns, but it's a very interesting area of tissue healing. And if you want to read that case study and learn more about it, it is in the module for you.